billion activity by government's own estimations costs the state about 1.5 billion every year. That just doesn't make any sense.
First of all, Trina, you're very welcome to come and have a conversation with King Sport. I think for, I suppose, the audience, people that are listening, maybe tell us a little bit about who you are and what you do.
So my name is Dorita Dunt. Professionally, I'm Global Head of Oligonucleotide Reagents. That's a critical component for vaccines. But my real passion is physical activity and preventative healthcare. I can honestly say that pharmaceutics have a huge role to play in the health of the nation, but equally important is prevention, and we're just not putting enough emphasis on it. So for me, I decided to use my professional career and my passion to work together with people like yourselves to hopefully change the health of the nation.
And you recently set up the Irish Physical Activity Alliance. Tell us a little bit about that.
So the Irish Physical Activity Alliance is an organisation made up of the health and fitness industries, doctors, medics, like-minded professionals who are seeking to have greater emphasis on preventative healthcare.
Mm-hmm.
We are really at a crossroads in Irish society at the moment. We're spending about 30 billion on healthcare, but 98% of that is on disease management, and only 2% on prevention, and that has to change. You know, we see politicians, you know, announce with such pride, you know, we've increased the lifespan of Irish citizens to 82.
Yeah,
just quality of those years, it's important, and that's where we're really falling down. And that's what the Irish Physical Activity Alliance was formed to do, to help change that. We need to have prevention and physical activity fully integrated into our healthcare system, and that's what I hope with the organisation to achieve.
I was actually at a conference yesterday and this conversation came up, and I suppose it comes up in the world of work that we're in as well. But there's a suggestion that we should be considering I suppose a proactive and a reactive budget for healthcare. It was actually not a president, I suppose, otherwise known as president, actually, you know, made the comment and was talking about having separate budgets where there's a, you know, prevention budget and a proactive budget that cannot be touched and is always, you know, there, you know, in terms of ensuring that we're, you know, putting the right systems and structures in place for physical health, mental health.
The government are slow to change when things are easy. When something requires a systemic change, it isn't going to happen. Mm-hmm. But the principle is completely correct. We need to be proactive. At the moment, our healthcare system is predominantly reactive. We wait until someone falls sick before we give them support, and that just doesn't make any sense. But it really came to the forefront about 14, 15 months ago when my mum took a heart attack. And we became involved in the healthcare system. Mm-hmm. And I really saw the difference between my mum in her 70s and her now life compared to the people that I see in the gym in their 70s. And there's just no comparison. Mm-hmm. You know, and my mum's heart attack, because it's in my mum's instance, it's very much a lifestyle disease, is completely preventable, or we can delay it significantly. And we really need to do that. And to give you one example, you know, in my own case, obviously I need to take a statin because I have familiar heart disease. Yeah. But most people in Ireland are different than me. But I need to take a statin, and I need to do physical activity if I want to have a long and happy life. Now the government will pay for my statin. Yeah. But they won't support physical activity. Even though not only does it benefit my heart, but it benefits every aspect of my health, from reducing cancer to reducing the possibility of dementia and preventing osteoporosis. Every single aspect of my health is improved by physical activity and strength with no side effects. Mm-hmm. But the government chooses to support a statin and not physical activity. And that, as an analytical chemist by trade, makes absolutely no sense. And then I begin to look into it further, and I know for government in a lot of instances it's about balancing the books, and it just seemed absolutely ludicrous, even from a financial standpoint, regardless of the emotional and the ethical standpoint, to only support people when they fall ill, rather than being proactive and support people to prevent them falling ill. So it became a journey from there. I assumed that we had an organisation who was lobbying for us in this regard, But it wasn't really galvanized and hadn't really penetrated the way it would need to.
Yeah.
So I decided to do something about it, because, you know, I recognise that there is a little bit of snobbery within government, and they were more willing to listen to me as someone with a pharmaceutical background, more so than maybe someone who came from a purely fitness physiological background. So I began, because I think a unique perspective, having my in both worlds, to start engaging. I was very lucky that I met some kindred spirits in both Malcolm Byrne and Albert Dolan and Christy O'Sullivan and Jack Chambers, who have all been incredibly supportive of the policy. I think it particularly helps that Jack Chambers is a doctor, and his parents are doctors, so he gets it. He gets the fact that investing in prevention isn't a cost, it's an investment in the long-term health of the nation. Unfortunately, not all politicians see that, but so we began the conversation, and over about 14 months ago, and I'm lobbying really hard for Budget 2026.
Talk to us. Well, I suppose there's two things that I'd like to dive into. Firstly, from an economic perspective, you've obviously mentioned, you know, in terms of the cost of healthcare, and that what we're doing essentially is disease management at this point, as opposed to this kind of proactive, you know, vision and viewpoint that we could be having when it comes to the healthcare of the nation. So, talk to us a little bit about like what it is costing us.
Well, I think the first thing to recognise is that physical inactivity, by government's own estimations, costs the state about 1.5 billion every year. And that's only going to get worse. You know, the governor of the Irish Central Bank came out only on Monday stating that with an ageing population, it's no longer a choice. We have to, you know, become involved and support prevention. You know, we have been very lucky in Ireland to have huge corporation tax, and that allowed us to try and outspend the problem. But that isn't happening moving forward. We have to be more strategic. And the best thing we can do, and this isn't me, this is international evidence, the best thing we can do is to support people to stay fit and strong, in particular with an aging population. So I suppose what I'm asking the government is to follow the science. Apart from the financial cost, the emotional cost, as someone who sees people in a nursing home on a daily basis, as someone who knows in the next 5 years we need a 60% increase in nursing home beds, as someone who knows that dementia is going to increase double in the next 10 years. So think of that cost if we don't respond. And we have time to respond, but we need to start now.
So we obviously have, you know, already mentioned the fact that the population is aging, life expectancy is increasing. But what is that kind of quality of life that people are having from the research that you've done?
Well, the quality of life, unfortunately, is declining. You know, the average person in Ireland will spend their last 15 years with a disease. Now, people think I made up this figure, but 63% of Irish people over the age of 45 are on polypharmacy. That means they're taking 5 medications a month. You know, dementia is going to increase, double in the next 10 years. Ireland has the highest rate of osteoporosis in Europe. Chronic disease is on an upward trajectory. And we know we can counteract it, or delay decline by physical activity and strength. And we just haven't been addressing that effectively. There's this, you know, anecdotal evidence. You know, everyone knows that exercise is good for you. But people don't really know the extent of it. You know, like just 30 minutes a day will give you most of the health benefits. And we talk about the sports monitor, about, you know, people in Ireland are getting healthier. Well, that's the way we're metricing it. That sports monitor doesn't metric strength training, which is by our own guidelines and a critical health monitor.
Talk to us a little bit about the guidelines, because I know something we obviously have discussed before. So what are the guidelines? What is the awareness level of the guidelines? And then I know what they are for teenage boys and teenage girls, but if there's any other details that you have, it'd be really interesting to hear that.
Yeah, so for the adult cohort, for most people be listening, it's 30 minutes of cardiovascular, anything that increases your heart rate, 5 times a week. And then in terms of strength training, it's two sessions a week hitting major muscle groups like your legs and arms. The awareness levels around the cardiovascular health is quite high, at around 60%. In terms of the awareness levels for strength training, it's practically nothing. And I say that because the Institute of Public Health did a survey, and this was of medical professionals, of GPs, and they asked them what the guidelines were for people over the age of 65 and how comfortable they are prescribing and having that conversation. And what would you say the rate was? These are doctors.
1 in 10.
5.6% of GPs knew the National Physical Activity Guidelines in relation to strength training for people over 60 and felt comfortable discussing it. If there's that level of misinformation or knowledge,
a lack of confidence even in knowing what it is.
In our health professionals, how do we expect the general public to have it? You know, so we have these guidelines, but at the moment they're more of a wish, because even if people do know them, there's no clear pathway to achieve them. Like, if we take the avatar of what government say they want to start getting healthy, so men or women in their 40s or 50s, they're sitting on the sofa. It's lashing rain in November, it's dark. How do we say to my sister, where does she go, what does she do? She probably wouldn't want to go out in the rain. She doesn't.
It's November, you might, as a woman, not really feel safe as well. That's
exactly. And I didn't realise this because I'm in my bubble and I know about it. I just assume everyone understands what resistance training or strength training is. They don't. I presented to a group of women, the ICA ladies actually, and I was given a presentation on the importance of strength. And one lady put up her hand, and I assumed she was going to ask me about a protocol or whatever, you know. And she said to me, "What's resistance training?" And then it dawned on me, we have that level of knowledge gap, and the government just aren't addressing it. So, you know, when we talk about what we need to do to improve the health of the nation, we need an education campaign, and we need to remove the barriers to entry. And that's a big part of what the IPA are pushing for Budget 2026.
And I suppose when it comes to thinking of, like, we're I suppose talking about like what the recommendations are, we're talking about statistics and stuff, but what is the reality of the situation when it comes to, you know, maybe let's talk about some of the Asian population. You know, you're talking about, you know, broken bones. You probably have a better list than I will. But it is the ability to do things and live a healthy life. So it is being able to, from a strength training perspective, you know, go down to the supermarket, do the shopping yourself, being able to lift the bags. It is being able to reach up and do that motion of, you know, putting things into a press. It is, you know, not being out of breath going up and down the stairs from a cardio perspective. So talk to us about the practical, like, what are the pictures that you can paint for people to maybe understand, you know, their current position and what their future could look like, or maybe to relate it back to, you know, maybe people in their 70s or 80s that they have in their own lives, whether it's parents or aunts and uncles.
Yeah, so the thing that allows you to live independently and well in later life is muscle mass, strength and mobility. You know, and that's the thing that we don't have enough education on. We don't have a clear pathway, and it's particularly missing for people, particularly women, because for years, you know, we were fed the be skinny, don't be too muscular. It wasn't seen as attractive to strength training, and all the research, and Jesus, it's everywhere now, which is great. You know, that pre, post and during menopause, that we lose so much bone density and muscle mass, and you know, we're getting that information out there, and that's really good, but we're not creating a clear pathway for people to actually have an impact on their own health. So we do have this missing education piece. We do have that lack of clarity or clear pathway, but we also haven't translated, as you said, what that means in real life. I'll give you one statistic. I'm sorry, I'm an analytical chemist, can talk about statistics all day, but I'll give you
We'll try and paint the pictures as well as doing.
I'll give you one statistic. You know, 50% of people over the age of 65 will break a hip. And everyone knows the statistic that within 3 years, you know, and 25% down will be it. But it's not just that. It's the fact that when you break a hip, suddenly your world becomes really small. You stop socializing because you lose mobility. That lack of social connection is a huge factor in the onset of dementia and cognitive decline. Lack of mobility is one of the leading reasons you end up in nursing home. But we're not recognizing that now.
Joining all of the dots.
Yeah, why in God's free earth is Ireland the number one country in Europe for osteoporosis? And a big part of it is that we had that culture where women were told to do cardio, that was their focus, and there's been no conversation around women and strength training until now. And even now, we see it because we're in that niche, but the general population don't. And it is an absolute disgrace and a public health failing that we will metrics. Like the Sports Monitor, which is meant to be our guide on how healthy we are in terms of physical activity. Like the question on it is about, are you active 3 to 5 times a week? That is so subjective. It can't give any real value. And
so you're saying this in terms of recommendations, we have one thing, we have cardio and strength over here, but the way that we're measuring it is not actually kind of just mirroring it to know whether we're actually hitting those goals. And I suppose, again, like, we don't need a false sense of security, we need a reality in terms of like the picture of what the country looks like and the direction that we're going. And I know that you had mentioned the statistics on nursing homes, but I found a quote from you in something that you done last year where it's saying that currently it's projected to need an additional 45,000 nursing home beds by 2031, an increase of 180%. So there's a huge increasing need for nursing homes. But if we can get this kind of joining the dots even in the measurement gives us a real understanding of where we're going, rather than, I know we've spoken separately and like we're going to land ourselves potentially in a hole if we're not actually addressing these things and putting the right measures in place.
Well, government's own statistics say that we need a 60% increase in nursing home beds. That reference is from the Nursing Home Society. So even to take the government's figures, I do not know how I sit in front of you today and can say how our government are going to have an increase of 60% nursing home beds in the next 5 years, because we don't have the planning permission, we don't have the land, we don't have the ability to build them, and we don't have the staff to support them. So it makes no sense
without knowing the full cost of all of the things. Like I would think as your average person that the cost of building all of the nursing homes, training all of the people and being able to facilitate that is going to be much more expensive than educating people on getting people moving into the gym. Even if you take the age of 65 when people are hitting retirement, trying to do some preventative measures and stuff then, and keep trying to keep people, if they are still in their homes, active in some respect, to try and keep them in their homes and not having to move into nursing homes that we don't have in the first place.
Well, there's an aging in place policy where Minister O'Donnell allocated 41 million to support people to stay in their homes. Not one penny of that has been allocated to strength training. And we'll buy you a stairlift. But we won't support you to keep your legs strong to stay at home.
And again, it seems like the stairlift is going to be more expensive than the exercise, like the education and then trying to.
And governments sometimes say, there's no precedent for this. We can't implement something that doesn't work, and we need to have a proven precedent. Well, I sit here and say Singapore. Singapore on retirement give you free access to gyms.
Your bus pass and gym membership.
Yeah, that's it. And in that regard, Singapore now is the healthiest country in the world, and they have delayed nursing home admissions by 4 years. Now, that doesn't just make fiscal sense, because we know keeping someone in a nursing home in Ireland costs 55,000 per year, but it makes really good moral sense. Like, if you can say to someone, we can give you 4 good happy years, isn't that better than spending 200,000 to let them look at a window in a nursing home? And I don't care what anyone says, there is a place for nursing homes. Absolutely. But we need to try and delay them as long as possible, because it's not somewhere anyone, I think, wants to go.
And it's also thinking of the like, we're talking about physical activity and exercise and sport, right? when it comes to being involved in those things, from one sense, I suppose there's the by being involved, and whether it's leaving your house to get involved with some of these things, maybe it's going out to your local club or community centre or something like that. There is also that connectivity in that, which is going to increase your, mental capacity. It's going to decrease loneliness, which I think Ireland is, scoring quite highly in terms of the rate of loneliness. Well, by keeping people's minds active as well, like I know you've mentioned around dementia, and the statistic there that exercises has an 8% impact on dementia, and that obviously someone might be physically able, but they may not be, I suppose, compass mentis to stay at home as well. So it actually can do both things. Have an impact there in keeping people out of nursing homes.
Yeah, social connection is really, really important in that friendship group, and I think that's where clubs and gyms really have that impact. Where we see pubs and post offices closing down in small communities, we see gyms and clubs flourishing and opening up. And that's just as important as keeping people strong. And that, I think, it becomes very apparent when you spend some time with people as they age. The world gets very small.
Yeah.
And that's because they, for a variety of reasons, but one of them is they're less mobile, they're less engaged, and less out in their community. So anywhere we can make life bigger, get people to feel involved in their community, that has to be a plus. And gyms now and clubs are the third place.
Yeah.
They are where people are making friends, they are where people are engaging, and we really need to support and recognise that. Like, I'll give you an example. Radifast up in Donegal, there's a population of 145. They have a boutique gym. Hackle, 2,500 people. They have 4 gyms. Like, they're everywhere. There's over 1,000 gyms in the country. When I talked earlier about it's not enough just to give people the information, we have to give them a clear pathway and how they can do these things. And we have to work together. And we can't say that we need people to be physically active, but then not give them an opportunity or way to do that. So we have to.
Yeah, I know this. We might dive into kind of the education on it in a couple of minutes, but I suppose the one thing about the aging population that's striking me as well, and like, in terms of whether it's the physical ability or it's the compass mentis capacity that somebody has, is actually the impact that it can have on families. I know there's this conversation about the kind of generation that's in between at the moment. I would see in like my own family, in terms of the work that has to be done to support my grandparents, and like all the effort that like my mother and her brother have to do to keep everything kind of ticking along. But from that perspective, like, it actually has such a knock-on effect to the wider family. It's not just the 1 or 2 elderly people that you're trying to support. And in some cases trying to keep them out of the nursing home, but it's the impact that it has across the board, and the need, I suppose, for family support. If we can delay that, it obviously gives the family back a lot of their time. It takes a lot of pressure off as well. I suppose the other thing that struck me, I suppose, in terms of that, is also women are doing a lot of the elder care. They're more likely to be stepping back from work. There's a lot more women in part-time work than there are men. There's a lot more, I suppose, women that aren't working than men as well. So that actually can have it from a female perspective. And obviously, if we are sitting here, coming from a her sport angle, like that, I suppose, opens up a whole kind of new world for a lot of women if we're able to alleviate that.
Oh yeah, we hear all the time, carers need to be supported, and that has to be the case, because in a lot of instances the carers end up sicker than the person they're caring for. And not to be cynical, but when the government go on the doors again in 4 years, it won't be childcare that people will be talking to them about. It'll be about elderly care. It's those sandwich people in the middle trying to raise their kids and support their elderly parents. When we don't have those nursing home beds, can you imagine the conversation on the doors in 4 years? So
it's the cost of it as well, because I know there's obviously some supports that are there for people, but there are people that in terms of the cost to get people into the nursing homes, it is a very expensive thing.
Oh yeah.
Which can fall back, like, yes, I know there's some state support, but it can fall back on families as well.
Well, there's obviously the fair deal, but I think collectively it costs about $55,000 a year to keep someone in a nursing home. And that cost is just going to increase. As I said earlier, we can't, there's just no way as a state we continue increasing our spend in healthcare the way we've been doing. We don't have the corporation tax.
Yeah.
So we either get smart and build a long-term strategy, or we face a really, really difficult future in terms of healthcare.
And maybe let's just jump back into, I suppose, what you mentioned about, from a female perspective, like what was, advertised and what was, described as, like it was this, perception that being thin was the ideal, and then you're saying that we're missing out on this, strength training that, I'm aware of. I'm looking to have, I suppose, come into it in my early 20s, as opposed to actually being aware of the importance of it as a teenager. Although having been heavily involved in sport, I would have grown up watching things like America's Next Top Model and stuff, which, in hindsight, I do query, like, how come something like that was on television in the first place. But if you go for people that are, more senior to me, and then, maybe into people that are in the 40s, 50s, 60s, and we're talking about the perception of what was beautiful and what was, considered stereotypical for being a woman. So let's consider some of those people now who maybe are doing the elder care, or are maybe heading that direction themselves, where they're finding that they're, not able to lift the bag of shopping, or they have fallen and they've broken something. They, have osteoporosis, women that are going through menopause. There is something that actually can be done about that generation before it's too late, because we can support them and direct them and signpost them towards a healthier lifestyle, towards being more physically fit, towards being stronger. That if we act now, in the next couple of years, we could actually take some of the pressure off the healthcare system.
Fundamentally, all the science indicates that you can rebuild and regain muscle at any age. There's a really famous study where they looked at a triathlete in their 80s when they worked in for a 16-week program, and they rebuilt muscle to that when he was 60. So there's no reason why we can't rebuild and regain strength. We just need to have the political will, have a clear pathway, and start.
And I think maybe in relation to that, maybe for that generation as well, is the education. And it's not that it's just specifically, that cohort of women that need to be educated. There's a lot of men that need to be educated, and I understand that, I suppose for some people, the gym is still a relatively new concept. And as you said, not everybody understands what strength training is, what resistance training is. But for those, I suppose, that pocket or that group of women, they have a lot of misconceptions about going to the gym in the first place. So that's where the education has to come in.
Yeah, and I think people still have the perception of gyms being, full of 20-year-olds looking in the mirror, wearing lycra and there because they want to look a certain way.
Yeah.
And there is a certain cohort of that, of course. But the vast majority of people now join the gym because they want to stay fit and healthy. The fastest growing cohort in the gym community is the above 50s. So we have an opportunity now to capitalize on that mindset shift, but we really do need to get that message out there, and we have failed to do it. I look at road deaths, and obviously absolutely tragic. I think 176 people have died on the roads in Ireland this year. We will spend about 6.5 million in terms of road safety awareness, which is critical. And I'm not contradicting that we need to spend that, but 1 in 6 people in Ireland, deaths are exacerbated or involve lack of physical activity. And yet we spend almost nothing on that education piece. And we keep talking about, and for me, this I think is a failing, is that we keep talking about physical activity predominantly in terms of sport. And for most people, they just don't see themselves in sport. Like Women's Week of Sport, European Week of Sport. Now they will talk about movement, but even the title says something. Like I look back to Women's Week in Sport a few months ago, and the people they most want to get engaged are women in their 20s to 60s. They want them to start their back training. They want women in her 40s sitting on the sofa thinking sport is for her. Semantics matter, and they recognise that. Like in Canada, for example, they've changed it from the Department of Sport to the Department of Sport and Physical Activity. Like, I'm not saying that sport isn't critical, and I'm not saying that it doesn't have a hugely important role to play in society, and sport is for some people, but we have to recognise that the vast majority of people in later life choose personal exercise, and rather than try and force them into a sport, why don't we recognise that and capitalise it?
The language one is an interesting thing, actually, because we would even talk about the use of the word athlete, and that people don't necessarily see themselves as an athlete. And I have experienced that myself, and then kind of been like, well, how did I never identify with the word but I was involved in organised sport training 7 times.
Yeah.
Or seven days a week, 10 to 12 sessions. Like, that's a ridiculous concept that I didn't identify with the word athlete. And I only found the experience when I lived in the States, and I would have had friends that were calling themselves athletes or college athletes or whatever. And I was like, we actually do have particular labels, and that's why the words matter. So in what we're saying is, from our perspective, athletic sport, like what we want to see is people involved in exercise, physical activity, sport, whatever it is that form of movement to try and lead a healthier lifestyle. So if we need to, examine what the words mean to people and to try and welcome them in, to get involved in whatever shape or form that looks like, then they're some of the things that we need to do. And as you said, like, recognize that, meet people where they're at, essentially. So if it is that, the world or the Ireland that they grew up in, that sport, wasn't accessible for women, or that it wasn't normal, and that the, things in relation to the gym. And there's lots of, sports that even, until more recently that we're seeing more girls women getting involved, like rugby is one of them. Like, it's a relatively new sport for girls women, so we do need to look at some of those things.
Yeah, I think what we need to do is just get people aware of their bodies.
Yeah.
And whatever form they choose to keep themselves active and strong, that's what they need to do. But we need to be honest with people and say that in a lot of instances, walking isn't enough, especially as you get older. And give people a clear pathway to achieve these things. And I think sometimes when we talk about strength, we forget the hugely empowering aspect of strength. And that, like, I'm from you can probably tell the accent, I'm from a very working class background. And I happen to have, a good career in a pretty male-dominated environment. And I remember the nervousness around doing things that I'd never done before, or going to, Michelin-star restaurants, or things that just felt outside my comfort zone. But I go into boardroom meetings and, like, you'd meet people who had better watches or flashier cars. You could tell that they had, that real middle class, private school sense of entitlement, or that they should be here. That was just assumed that this would be their role. And me with a big imposter syndrome. But being strong was my secret weapon. And I'll tell you why, because you go in and I would always wear a dress where you could see I was really strong and I had big arms, and it was like, I can look you across the table and I don't care what your dad bought you, I can outlift you. And I meant as in, I work harder. My physical strength says something.
It was
about
giving
me.
confidence.
Yeah. And
and there is a lot of research to show that being involved in sport and exercise will give you that confidence.
Hugely, and I see, we hear about uplifting working class communities, and I cannot express enough the importance of making someone feel good and comfortable in their own body.
But I think even maybe the example that you've kind of given there as well is something that can be, very much seen that somebody doesn't have the confidence to go into the gym and know what they're doing in the first place. So we need to make sure, whether it's, as we're saying, into gyms or into classes or into sports, that people feel comfortable in the environment to know that it is open to them.
Yeah, and I think a part of that is changing that perception of the gym, and the Irish fitness industry have a role to play here too, to support people to understand, to utilize most gyms are empty between 9 in the morning and 4 in the afternoon.
Yeah.
Make those times less expensive, more accessible to people, like we did during COVID. So for example, there may be an hour or two where it's only available to people of a certain age.
Yeah.
Or that we make some gyms,
or it's like beginners or something like that, so people know there's extra people on the floor to support with the
and it doesn't have to be the gym. Like, obviously what I'm lobbying for is a tax rebate for gym membership, but that's an overarching name more than the actual policy itself.
Maybe that's
an
explanation on what you are lobbying for and what the policy is.
So
I know we've been talking about a lot of stuff. We haven't actually named it. I know what it is, but let's share it with everybody else.
So there's two main things within the IPA we're asking government for, and that's a tax rebate for gym membership and a national education campaign on the importance of strength training. Now we've laboured the point about the education piece, which I don't think anyone could say isn't important and needs to happen. But in terms of the tax rebate for gym membership, there's two things that are important about that. I think firstly is the recognition that physical activity is a medicine. The recognition that physical activity is as important as going to the doctor or taking your statin, for want of a better word, because we can't say that it is that important, but yet treat it differently in the tax system. So we will pay, and I'll use myself as an example, if I go to the doctor or if I take my medication, I can write that off against my tax. Physical activity is just as important, maybe more so, and just as effective, maybe more so even in terms of my long-term health. So it has to be treated
Well,
the
share
same
the
way.
statistics that you would have shared with me in relation to the impact that the statin can have, and the impact that exercise can have, and obviously, your experience.
Yeah, so in terms of risk reduction, the statin is around 23%. Now, exercise is similar, but if you have cardiovascular training with strength training, that risk reduction increases to around 33%. So in terms of at a population level, resistance training and exercise is more effective. Now it depends again on where you are in terms of your journey and your lifestyle, but as a general statistic. And this is not an exaggeration to say that if you could, and this is Professor Niall Minan's quote, if you could package the benefits of physical activity, it will be the most prescribed pill in the world. It, in general, reduces your risk of cancer by over 40%, reduces your cardiovascular risk by 40%. If we can keep people at a high level of cardiovascular fitness, women in midlife, reduce or delay their chance of getting dementia by 80%, and that's 80. It's that impactful. So we cannot treat it like it's a nice to have. It's a luxury. It has to be treated as a medicine, and as such we need to align it with medicines, because that's not just important in terms of reducing the barrier to entry, but it's important in terms of the mindset of the public. And I've heard some pushback from government, and I'll be honest with you, it's predominantly Fine Gael, stating that this won't encourage people to go to the gym. And I'm bemused by that, to be honest with you, because we have precedent. We've seen it in Newfoundland and Canada, and they've implemented a similar policy and an increased gym membership by over 15% over 5 years. Now, I'm not just saying that the reduction in cost did that. It was that realignment and the mindset shift in the public. But secondly, there's a huge cohort of people, the squeeze middle, the working poor, who don't fall into the safety net of our social system. And there are people in their 30s and 40s, the exact people we want to be exercising for their long-term health, who are trying to pay their mortgage, trying to pay their childcare, trying to make ends meet. Because as much as people want to say there's not a cost of living crisis, there is. Groceries are going up 15%. So when you're sitting at the end of the month and you think, what am I going to cut? The thing that gets cut is gym membership. It's always cited as one of the top 2 reasons people cut gym membership. So we need to offer a barrier in terms of incentivizing and giving support. But we also need to help people at the end of the month, when they're making decisions, to really clearly know that physical activity is not a cost, it's an investment, so it needs to be prioritized. So I don't know, we've done a bit, so basically a tax rebate for gym membership and an education campaign. But it's really not about just giving gym goers a tax relief. It really isn't. It's about changing the mindset of the public to recognise the importance of physical activity. And I'll be honest with you, the most pushback I'm getting from is Fine Gael, and I would ask anyone in Fine Gael to tell me what they've done to date that has actually had an impact. And what is their plan? If we are not going to do this, can you tell me what we're going to do at a population level to increase physical activity? And they don't have that answer. So for me, I would say, not only does this make sense fiscally, it makes sense morally, but we have to do something now. We can't just keep delaying. We need to have a strategy. We need to take action. I think you said to me, was it Brezzi was saying, what were you saying there about Brezzi?
Talking about having a budget from a proactive and a reactive perspective, essentially, that we have, Wooders that are, trying to ensure that we're preventing certain illnesses and diseases, etc. And that there can be things that can be done.
And the key word there is reactive. We have a healthcare system that is purely, it responds to a crisis.
Yeah.
When are we going to have long-term planning?
Yeah.
We talk about, we talk about the housing crisis, we talk about our infrastructure crisis, and all of that is lack of long-term planning. We're saying now in healthcare, we need long-term planning. We're coming with a policy saying this enables you to do it. How anyone can say this doesn't make sense is beyond me.
I suppose in terms of like some of the questions or some of the pushback that you've received has been around the fact that some people are already have gym memberships, and is it just going to benefit them, and is it actually going to encourage more people to get involved? There's definitely a bracket of people that are going to get a gym membership because they can afford it, or because there's a tax rebate on it. The other thing I suppose to note is that it is available for sports clubs too.
Well, I would recommend it, because I don't think we should say what's important in terms of physical activity and not. For me, I would say...
So it's gyms, studios, potentially even dancing and stuff should be falling under it as well?
That would be my reckoning. If we look at Newfoundland in Canada, what they do is their policy enables any activity that increases your cardiovascular health or increases your strength and bone density to critical healthcare measures. If it does that, it should be eligible. But in this instance, we're saying we start small and we build. And the reason we went for the tax rebate and gym membership is because there's 800,000 people in Ireland who go to the gym. If we can even increase that by 10%, it will have a significant uplift in terms of the health of the nation and a significant decrease in terms of the pressures on the HSE. So, there's no point having policies that have a little impact in one town or something. We'll trial something in, I'm from Fingal, we'll trial something in Fingal, and then maybe in 5 years we'll look to roll it out nationally. We need something that will have an impact on a population level now, and this is the best way forward.
And the other thing, I suppose, the question that you've been asked or that has come up is in relation to just because someone has a gym membership doesn't mean they're going to go to the gym. So I suppose what's your response or your opinion on that?
Yeah, I think that is the case. That's where the education piece comes in. They've already taken the first step. So they recognise that physical activity is important at the gym, but they haven't been convinced that it's important enough to prioritise it. And that's where that education piece come in. I'm not saying this is a silver bullet, this is going to solve our healthcare crisis, but I'm saying it's a critical first step in building that roadmap of prevention that we haven't even started to build.
I suppose maybe consider from the female perspective, like we've talked a little bit about the generation where being involved in sport, exercise, like lifting weights, essentially wasn't normal. But it is also to be aware of the situation that we're in with a younger generation too. So in terms of, some of the statistics that we would talk about is that 1 in 5 girls between primary and secondary school will drop out of sport. That's in comparison to 1 in 20 boys. And then we have 1 in 2 girls dropping out of sport by the age of 20. So it is something that if we don't try and educate, right from, primary school, up to the women that are in their 50s, 60s, 70s, and that will continue to increase because we are still seeing a lot of girls and women drop out of sport. But then, we can talk about also the physical health journey that women will go on in terms of, reaching puberty, experiencing period and menstrual cycle. Then there's the potential for many women to go through pregnancy or multiple pregnancies, and then there's also going through menopause, which you've also mentioned as well. So in terms of the journey of a woman's body and the different things that they're going to experience had a huge impact in terms of their health. You've already mentioned osteoporosis, you've mentioned dementia. What are some of the other things from a female specific perspective that we're seeing and that exercise can support with?
Well, cardiovascular health, which is particularly important for women, again, during that menopause journey, we need to lay a strong foundation in terms of muscle mass and bone density. So when we get into menopause or perimenopause, that we're coming at it from a very high level, because if we lose 2 to 3%, if we're coming at a very high base, we're going to be more successful long term. I think you cannot underestimate the impact it has in terms of confidence, in terms of mental health, in terms of social skills.
I can give you a statistic on mental health for teenage girls. So girls that are involved in sport are 2.5 times less likely to suffer from mental health disorders. So again, that's more research that backs up being involved in sport. And
I think, again, we have to look at it from all cohorts. We have to try and educate children. We have to educate older people. But we talk a lot about peer influence, and the important piece here for me, and really important, and this is where we see the benefit of the tax rebate for gym membership is, in a family, a woman uplifts that family. And if your parent is physically active, the child is 6 times more likely to be physically active. So if we're talking about bang for buck, we get parents active.
Yeah.
We're talking about bang for buck, we get kids active. And when we're talking about parents who are in most instances in a household where both people have to work now because of the nature of the cost of living, when we're talking about people working long hours, realistically, the only option for those people is personal exercise, not a team sport, because they can't commit to being there at a certain time. So if they are willing to put the time and commitment into managing and supporting their own health, we as a government and as a country should try and reward that behaviour and incentivise it. So that's the real premise of the tax rebate for gym membership. It's not just for the individual, it's for the family, it's for the society. And I see that myself since I've started this, because I was never on social media until I started advocating for this. And the amount of people that are messaging me from school, going, "Oh, Dorina, I'm going to really, give me a real kick up the arse. Maybe I don't know whether I'm allowed cursing this or not." I've just seen that, I'm going to start.
Yeah.
So, there is that sense of peer influence.
Yeah.
And when it becomes the norm for people to be strong, and when it comes the norm to people to prioritise their own personal health, that has to be a positive. And if government aren't willing to recognise and incentivise that, they're mad. I think post-COVID is the perfect time, because people are in some ways turning away from pharmaceutics. And I think there's a hugely important role for pharmaceutics, so I'm not slagging them off in any way. But
they can complement each other.
They need to complement each other. And I do think there's that thirst for that information, that want to take ownership of your own personal health. And we even see it with teenagers and people in their 20s now. Wellness is part of their lifestyle.
Yeah.
And if we don't capitalise on that, we're missing a trick. It's not an understatement to say with the correct policies, we can, change the health of the nation. Like when Micheál Martin brought in the smoking ban just over 20 years ago now, the same people that are criticising or questioning the value of the tax rebate for gym membership, and hold on, we can't have a smoking ban, it will affect the trade in pubs. There's no indication that it will have a positive impact. It's been the most successful health policy, not only in this country, but in Europe. In its first year, it saved over 8,000 lives in Ireland. This could be the start of that same transformative effect. So I would say, follow logic.
Because I did ask you the question previously in relation to, from a economic, perspective. Obviously, there's a lot of pharmaceutical companies in Ireland, and obviously the impact that has. And I suppose you had mentioned the fact that we are going to be on different medications as we age. It just might happen a couple of years later. So we're always going to be customers of pharmaceutical companies. So maybe just talk, because I suppose I was wondering, are we actually interested as a country to try and, encourage people to live healthier lifestyles? Or do we want them to be paying for the drugs? Do we want them to be paying, the pharmaceutical companies from an economic perspective? But you had a response in relation to that.
Yeah, I think the automatic assumption is that this will be pushed back, will get pushed back from pharma on this, and that's not the case, because it'd be very short-sighted of them.
But even from a government perspective, because obviously the value it has from the companies here, obviously the employment rates, etc.
Well, look, when you talk about employment, last year we had 3.52 million sick days because of physical activity. That cost the state over, I think it was 500 million. I don't have the exact number. So we need to keep our working age population healthy. Especially with the aging population, because we need people to work to pay, my retirement. Your retirement, let's be honest.
I'm a bit off retirement. I'll pay for yours.
Yeah.
Have to find someone to pay for mine.
This is where she implies she's 40 years younger than me. But anyway, no. But in terms of the pharma companies, if we take my dad as an example, my dad died at 49. So he didn't end up taking all those products.
Yeah.
And a big part of that was A, heart disease, and B, the lack of physical activity. Whereas I will take those products probably for the next 40 years. So as we look for people to live longer, they'll probably be under medication for longer.
Yeah.
So their revenue model is still very strong.
Yeah.
So I don't see this contradicts with our pharma in Ireland. If anything, I think it complements it, because when I talk about we've only 2 to 3% prevention, I'm not saying that we suddenly stop managing disease.
Yeah.
What I'm saying is, let's be smart, let's be strategic, let's have long-term planning, and let's support people now so that 97, 98% that we spend on disease management is spent on the people that actually need it. We've got extending waiting lists. We've got people that should be treated sooner that aren't, because we just can't manage the number. So the best way to reduce that burden is to keep people healthy, and the best way to keep people healthy is physical activity and strength.
I think the other thing that strikes me about policy, and obviously, I tend to look at everything with a bit of a gender lens, but I would have been involved, in conversation around the National Women and Girls Strategy, last year. And when it came to that, I think one of the things that struck me was in relation to, safety for women when it comes to exercise. And you're talking about adults, and particularly when, people have kids and stuff as well, not being able to be involved in sports, although, the sports club offers a safe space for people to exercise as well. But if your option is, to be faced with, going for a cycle or going for a run, like a lot of women are put off going out and exercising in the evening in the winter months because it's dark, and because obviously of a number of different incidents that have happened not only in Ireland but also globally against women when they are outside by themselves. So something like this tax rebate and being able to then maybe access, because again, parents are likely to be putting their kids in front of themselves, so they'll try and prioritize having the kids involved in sport over maybe paying for their own gym membership or their own sports club membership or whatever that looks like. So that actually can, create a safer environment for women to exercise, and also something that maybe becomes affordable to more families in relation to that, because whether it's a sports club and they can go down and use it, or whether it is in a gym environment or a dance class or whatever, it is providing a location for people to be where it's lit. Like I would query in relation, and I brought this up with TVs previously, in relation to the fact that a lot of the parks in winter time, the lights aren't on.
Yeah.
So there's not actually, so even if we had the lights on from 7 until 9, and people knew that there was going to be a group of people around, going walking, going running, and that was a safe environment for them to be in, and then sure, the lights turn off and light off, people head off home, at least we're again creating another space. But at the moment, we don't really have that for a minute there, put off that kind of exercise. I find it myself as someone that I would consider myself, relatively confident, relatively strong, and it's just like I sometimes even sometimes in a it could be 7 o'clock, 8 o'clock, and you still might not always feel comfortable going out for something like a run. But I would feel completely different, and actually was training for a marathon a couple of years ago, and I stopped running in the evening outside, and I would have gone down for my sins to stand on the treadmill, to be running on the treadmill for whatever, a couple of hours. But it did provide that opportunity, that environment to be involved and to be exercising. So that's something that I don't think we can take away from the impact that this could have.
Oh yeah, I completely agree. And I think we forget, well, it's predominantly men in government, forget that aspect of it, that rightly or wrongly, whether statistics play out or not, women are more fearful in darkness, running, training, earphones on. It's not a comfortable environment, and it's not necessarily a safe environment. But while the pushback I get from that is, we've agreed to invest 200 million in community clubs, the GAA, etc. We're going to expand them. Now, that is wonderful, and that should happen. This policy doesn't contradict that.
Yeah.
But say we're going to build a new facility in Balbriggan, this swimming pool that's been coming, I'm from Balbriggan, that's why I reference it, 10 years. We're going to have a swimming pool and a running track now. It's been in planning for 10 years, and we've got the funding now, so it's a need to go back to planning. I wouldn't say we'll have that in Balbriggan before retirement. So we can't wait for these things to happen. Because say in the next 10 years, there'll be more people on this island over 65 than under 18. This has to happen now. Like, I'm not saying that we don't build those sports clubs. I'm not saying that we don't build those running tracks. I'm saying do it. We need them. But we also need a solution that's effective now. And as I said, we've over 1,000 gyms in the country, ready, willing and waiting to support people. And if we don't utilise them, I just don't know what the other option is.
I don't have any more questions. I don't know, have you any more thoughts?
No, other than thank you for giving me the opportunity. I think the more we get this message out there, the better. It's like, it really annoys me when you hear someone like, the government don't believe this will work, or there's the tax strategy review group have done this. They never provide any evidence. I will sit and argue, debate, whatever you want to call it, with any government minister who wants to come and explain to me A, why this policy won't work, and B, what their solution is. Because that's all I've heard so far. Well, there's a lot of politicians who are supporting, some pushing really hard to get it in this budget. But for the ones who don't give me this, it's not broad enough, I'm not sure it'll work. Explain to me why it won't work, and explain to me what your other solution is, because otherwise the health of the nation is at stake. And I heard someone say it's we'll look to it maybe later in this government, because it is in the programme for government. They've committed to put it in the programme for government. Why are we waiting?
Yeah.
Why are we waiting?
Even just to get something started.
We need leaders. We need someone with a pair of balls to say, we think this is going to work, let's do it. Or if we don't, we need someone to explain why it doesn't work and what is their alternative. Because I don't know about you, and I'm talking not as chairperson of the Irish Physical Activity Alliance, I'm talking as Dorina here, as an Irish citizen. I am sick of just hearing this won't work, and tell me what will. And if it will and it's better, I'll support it. But if it isn't, someone get out there and lead, because we need leadership, especially in healthcare.
And I think it's in relation to, the fact that you have created the organisation, the fact that you're lobbying this, like you're doing this outside of obviously your, day-to-day job and pushing this forward. It's like, there are lots of things where people are having to, stick their neck out or to try and solve some of the problems in the country, because we're not always seeing the government are doing some of the things and answering some of the real questions that people have. And I suppose, in relation to like the work that we've done per sport, like we're representing 50% of the population and trying to ensure that girls and women feel like they have opportunity in sport, that there is media representation in sport, that there's education in the clubs, not only for the girls and women involved, but also for peers, for coaches, for sports clubs to have them involved. But I suppose it also, the question is asked is like, why is it taking like the most staff to come forward and do this? And we have seen lots of other organisations pop up to try and, really do what's right for society. For us, we're trying to push forward. For women, what you're trying to do is obviously push forward that there's a healthier, longer quality lifestyle, for the nation, and that we're not ending up in what you're saying also is, a very critical, expensive position as a country where, we are where we are now, and this cost of living crisis, what does that look like in 10 years, for people? But as I said, I don't have any more questions, and I'm sure
can I just say one thing? I really want to commend what you've done. It is absolutely phenomenal, and I think sometimes people assume that NGOs and government are making change. When you're living proof that it isn't government, it's individuals that see there's a problem and try and find a solution. And you've had a huge impact, so you should be incredibly proud of what you've achieved. It really is wonderful.
Thank you, and I have no doubt that you're going to push this forward, and that regardless of what happens, obviously with this budget or not, and I know we want to talk about like what we can do together, but a huge amount of it is education. As we've said, we have the reach and we have the a lot of alignment on the same things. But having met you a couple of times at this stage, I've no doubt that you will be certainly having an impact over the next couple of years. So congratulations.
That's the plan. Thank you.
So great.